The main question that has emerged around school reopening is exactly what the risk is and who that risk is to. So I think obviously whenever you have kids involved, the discussion is going to be fraught, and rightfully so. But I think in this case, the debate is about how much risk COVID actually poses to children. Kids can definitely get coronavirus. And I think one of the reasons this narrative emerged that they can't was because it was one of the few good pieces of news we had in March and April was that kids weren't getting it to the same extent as adults. And that is still true. You know, it is still true that by and large, kids are not going to be hospitalized. They are not going to have severe outcomes, but they can. One of the main differences that people have identified in children is that whereas in adults, we've heard so much about the respiratory aspects of the virus, in kids, it's presenting slightly differently. There's more abdominal stuff, more sort of traditional like flu feelings, and fever is a really strong indicator. Some data has suggested they aren't getting infected at the same rate as adults, although it's hard to know because many of them are asymptomatic. But what we don't know is how they transmit the virus. And so in that case, we don't know if they can give it to each other. We don't know the extent to which asymptomatic children can give it to teachers, to adults and their families, and contribute to the spread throughout the community. So when you see the debate about schools reopening, that is what these communities are assessing. And a lot of them so far have said, we're going to do something that is somewhere between normal operation and totally online. There's a lot of hybrid programs. There's a lot of, 2 days a week in school, 3 days a week at home. And all of that is just meant to limit the number of kids that are in the building. It's going to be sort of a process of experimentation. But so far, it seems like there have been several districts that have had to quarantine kids already and shut it down. So I think the basic solution is just going to be flexibility because it's going to be a lot of starting and stopping. And there's not necessarily any way to avoid that.